Hi, I'm Snigdha Sharma and you're listening to Three Things, the Indian Express news show. In this episode of Three Things, we discuss the US's offer to help India battle the second wave of the virus. We also talk about 4 opposition states saying that they cannot begin vaccinating those above 18 years of age on 1st of May. And we also bring you the latest COVID updates. With a crumbling health infrastructure, lack of oxygen, medicines, hospital beds, and more than 3 lakh new cases every day, India needs all the support it can get to battle the deadly second wave of the pandemic. The latest helping hand came from the Biden administration, but not after some hiccups. On Sunday, the US Secretary of State Antony Blinken tweeted, and I quote, "Our hearts go out to the Indian people in the midst of the horrific COVID-19 outbreak. We are working closely with our partners in the Indian government and we will rapidly deploy additional support to the people of India and India's healthcare heroes." Unquote. This was followed by US President Joe Biden and Vice President Kamala Harris promising India all assistance, including urgently sending medical life-saving supplies and equipment. In response, on Monday evening, Prime Minister Narendra Modi spoke to the US President Joe Biden and thanked him for all the support his country is providing to India. However, things were quite different only a few days ago. To talk about these new developments and what brought them about, we were joined by Deputy Chief of Indian Express's National Bureau, Shubhajit Roy. So Shubhajit, if you can begin by explaining to us the significance of America extending support to India at this point of time.
US and India have been very close strategic partners in the last few years, and the relationship has really covered all sectors, starting from strategic sectors to health cooperation, to space and everything. Now, health sector cooperation obviously has emerged to be one of the key pillars in the wake of the COVID-19 pandemic since last year. India had supplied hydroxychloroquine, if you remember, last year. And also the US had, in fact, sent in some ventilators for India under the Trump administration. So there was certain sense of level of cooperation. The senior officials were meeting. As the second surge really took off in India and has sort of almost crippled and overwhelmed the health infrastructure in India, especially in Delhi, there were voices from the US administration which essentially said that it was sympathetic towards India's situation, but it would prioritize vaccine supplies or other things for Americans first. So these kind of statements which were made by the US State Department or the White House, they didn't go down well here in New Delhi, and it was seen as sort of perceived as a setback for such a close relationship that India and US enjoy. So in the last, say, about 48 hours, there has been a course correction. And now on Sunday, the National Security Advisor, Jake Sullivan, he called up the Indian NSA, Ajit Doval, and conveyed that they are ready to help, ready to assist India in terms of key ingredients of vaccines, which will help in production of Indian vaccines in India, as well as ventilators, oxygen concentrators, and other such supplies, emergency medical supplies, which India is facing a shortage of. So this is a very key moment. And after that, we've seen a series of comments, statements, tweets starting from US President Joe Biden, Vice President Kamala Harris, US Secretary of State Tony Blinken. All senior officials have almost reached out and conveyed that they are ready to offer and help concrete terms. And that is, in a sense, is a change in the approach from the US administration from where we were, say, 3 days ago.
Now, Shubhajit, you said that the US is ready to help India with medicines and vaccines, right? But only a few days ago, the chief of Serum Institute of India, Adar Poonawalla, he had tweeted to American President Joe Biden and he had requested him to lift the embargo on vaccine raw materials. So, does this change in US's approach now mean that they will help us with these raw materials?
Yeah, so that was one of the points that was conveyed by US National Security Advisor Jake Sullivan. But there has been a sort of also nuancing by the Serum Institute, which has also said that it needs the ingredients for the COVID vaccine, which is still yet to come in production and yet to be available. For Covishield also, they have asked for the vaccine inputs, vaccine ingredients, and the American NSA has conveyed that they will supply vaccine inputs to India. So apart from that, obviously the Jake Sullivan's call to Doval was also about conveying that it will supply rapid diagnostic test kits or PPEs, ventilators, which will be immediately available for India. In fact, I think over 300 oxygen equipment have already landed in India on Monday. So it is rapidly being sent. And in fact, Pentagon has, the defense secretary has said that Pentagon will redirect all its resources and supply stuff to India, medical supplies to India on a very urgent basis. So that shows the sense of urgency that is being now shown by the Biden administration after this change of approach.
So now that the US is extending support in so many ways, right? What was the problem earlier? Like, what was the reason behind its earlier stance, which was almost the opposite of its current stance?
Well, it's difficult to say, pinpoint a reason, but possibly they were not sort of, and here I'm just analyzing from the statement that have come out, that they were not in tune or in sync, aware of the urgency of the situation that was unfolding in India over the last week or 10 days as the crisis really unfolded in terms of shortage of beds, shortage of oxygen. And there was a time lag between their sense of understanding the urgency and the urgency unfolding. And by the way, in the meantime, there were other countries like Germany and Singapore who were already on the ball. They had already started sending stuff through, obviously, the private companies. And now the governments of these countries, for example, the European Union has also now pledged. So there are several countries that have now come out also in support of India and is ready to offer concrete help, specific assistance in terms of medical supplies.
Now, we know that the Indian diaspora has been very active during the crisis here. If you can tell us, Shubhajit, what were the kind of campaigns that made the Biden administration change its mind?
Yeah, so Indian diaspora has been very active. You would know that we have right now the US Vice President is of Indian origin, or even apart from US Vice President Kamala Harris, the Surgeon General Dr. Vivek Murthy, he's also of Indian origin. Then there are a lot of influential sort of think tanks and lobby groups. One of them is US-India Strategic Partnership Forum, USISPF, which in fact is working right now to supply a dozen containers that will help transport oxygen within India. These containers are being shipped or airlifted from different parts of Asia. Another dozen containers are already being identified for shipment to India, and efforts are on to triple this number. Then there are people in the Indian diaspora and in USISPF who are working on airlifting oxygen cylinders into Delhi and a few other states that face shortage of oxygen supply. In fact, there's been an order to source about 1 lakh portable oxygen concentrators for use at home and hospitals to be shipped to India immediately. So these lobby groups, think tanks, they're already in touch with manufacturers in the US, Mexico, Malaysia, and China.
Now, talking about China, we saw support being extended from, what shall I say, unexpected quarters, considering what has happened in the last 1 year. Can you tell us more about this surprising new development?
So, on Friday, the Chinese Foreign Ministry spokesperson, Zhao Lijian, he made a comment that in Beijing that China firmly supports the Indian government and the people against the coronavirus pandemic, and it's in talks with New Delhi, it's in touch with New Delhi on its offer to provide support and help to deal with the surge. Now, on Monday, the Chinese Foreign Ministry spokesperson Hua Chunying and the Chinese ambassador to India, Sun Weidong, both have talked about Hua Chunying, the Chinese Foreign Ministry spokesperson. She said that Beijing is concerned about the grave situation in India and it is ready to help if India conveys its specific needs. In fact, the Chinese ambassador, who tweeted minutes later, said that China firmly supports India and he will encourage and guide Chinese companies to actively participate into the cooperation in facilitating various needed medical supplies for India. This essentially is very important because for the last 1 year, India and China have been at the loggerheads over the border standoff, and there's been a very difficult diplomatic relationship between the two sides. India has, in fact, been very critical of China's behavior, aggressive behavior at the LSE. There have been talks and there have been some disengagement, but the standoff still continues at many of the sites. But this is a very important signal from Beijing at this moment of crisis because it comes just hours after or a day after the US administration has extended its support. So from geopolitically also, this is an interesting play of events that has happened.
So next, if you can draw a comparison between the disparity in the vaccination drive in rich countries versus poor countries.
There has been vaccination drives in rich countries and there has been anti-vaccination campaigners also resisting vaccination drives in many of the rich countries, especially in the US. But still, a lot of people have been vaccinated. In New York, I believe almost 40% of the population the city of New York has been vaccinated. Similarly, in Europe also, although the pace was initially slow, but it has picked up. But in countries where in Africa or other countries, there has been still, because they're largely dependent on this COVAX facility, to which India has actually played a big role in supplying vaccines. If you remember, India supplied at least about 6.5 crore vaccines so far to more than 80 countries. So that has sort of won a lot of goodwill, but there's been a criticism of late from various quarters that India probably should have vaccinated its own people at a much more rapid pace than doing this vaccine diplomacy. But I mean, obviously, the proponents of vaccine diplomacy argue that, we are an interconnected world and that you can't be selfish when it comes to vaccination. You have to take care of other people, especially your neighbors as well. So actually, if you see the vaccination, that diplomacy or vaccine nation supply that India did in the last 2-3 months to other countries, they were mostly to countries which can be classified as the global south.
So, talking about vaccine equality, Shubhajit, many have urged the United States, which is obviously one of the most economically well-off nations, to help others. We also heard recently how America has a stockpile of millions of AstraZeneca doses that it will probably never use.
So as you know, that US has been really on top of a chart when it came to kind of getting as much of vaccine dose for its citizens and much more. And that has been a big criticism of the US administration, that it is sitting on, experts say that about 35 to 40 million doses of AstraZeneca vaccine Americans will never use. In fact, as the US administration was dilly-dallying on supplies to India, there was a very articulate and vocal pitch by the US Chamber of Commerce to release those vaccines to countries like India, which was facing this brutal second surge of COVID-19. And I think we don't know yet what the US administration will decide, but this is a space that needs to be watched out for, whether the US administration, after having vaccinated or after having taken care of its own population, whether it will supply those surplus vaccines to India and other countries which need it for as an emergency use.
On Sunday, 5 days before vaccination is to be opened up to everyone above the age of 18, four opposition ruled states said that they will not be able to begin the drive on 1st of May because they do not have enough vaccines. All the four states also accused the central government of discrimination in supplying oxygen and the antiviral drug remdesivir used in the treatment of COVID-19 patients. To find out more about what is going on, we spoke to Indian Express's Manoj CG. So, Manoj, what was the primary reason behind these state governments making such an announcement?
The third phase of vaccination for categories for first people above 18 is to begin on May 1st. So now these four opposition states, Rajasthan, Chhattisgarh and Punjab, all headed by the Congress, and Jharkhand, where Congress is part of the government, it's sharing power with the JMM. So the health ministers of these four states are saying primarily the reason they are assigning is that there is non-availability of vaccines. So Rajasthan Health Minister, Mr. Raghu Sharma, he said the state government officials have spoken to the Serum Institute of India, which manufactures the Covishield vaccine. So the feedback that they got from the Serum Institute is that they have orders from the central government, which they've already placed. So they will take time at least till May 15 to supply those orders. So only after that they will be in a position to supply vaccines to states. So in that scenario, the Rajasthan Health Minister says the state doesn't have vaccines now, doses now, to begin the third stage. According to him, there are only 8 lakh doses left with the state now, which they obviously are using now to vaccinate people above 45 years of age. So that is one of the main reasons that the Rajasthan Health Minister said. His counterparts in Chhattisgarh, Mr. T.S. Singhdev, and in Punjab, Mr. Balbir Singh Sidhu, and in Jharkhand, Banna Gupta, they did not specify whether they reached out to Serum Institute of India, whether they contacted, but they also said they don't have vaccines left. That is a primary concern that they've articulated.
So, recently the center came up with its new vaccine policy, right? We discussed it in the last episode where you had joined. Now, for this third phase of vaccination, is the new vaccine policy applicable? And why can the center not fill this gap in doses that these states require to begin vaccination on the 1st of May?
According to the new vaccination policy, 50% of the vaccinations, of the doses, which the states are expected to procure, they're empowered to procure, the 50% will remain with the center. So that 50% which the center has utilized for vaccinating people above 45, which the vaccination drive is already on. So the rest 50% the states will be asked to procure. So since around 30 to 32 lakh is the vaccine supply per day, so it comes to around 15 lakh, which all the states will have to procure from the manufacturers directly. So there is a shortage, which we have all been reporting. So that creates this problem for the states. So now the situation many of the health ministers are suggesting was they are drawing a parallel with emergency remdesivir, where there is no central procurement and center is not supplying the remdesivir drug to the states. So they on their own are procuring. So some states are getting the stock, some states are not. So there is a disparity when it comes to the procurement of remdesivir. So the states now they feel if this policy is adopted, they will have to approach the Serum Institute or the Bharat Biotech directly, where there is not enough supplies now. So that creates a problem for them. And there, of course, there is another unsaid concern is that some states could bid for procuring this vaccine. They could quote larger prices apart from the 600 rupees per dose, which Serum Institute and Bharat Biotech have specified. They could offer to give more and procure the stock. So all those things could happen.
Right. So, even last time when we spoke, Manoj, about what opposition states were saying regarding the government's new vaccine policy, right? One of the concerns that was raised was that smaller states like Chhattisgarh could suffer more because bigger states that are economically in a better position, they will be able to procure the vaccines first.
Yes. They still argue that the new vaccination policy should be reviewed in the sense the center should continue to procure vaccines and allocate to all the states. And they also have a concern with the pricing. because when they procure directly, the states will have to foot the bill and they will have to bear the financial burden.
So, Manoj, what are the state government's accusations against the central government?
There are too many in the sense the Rajasthan Health Minister yesterday was talking about oxygen supply. He said the state is being discriminated against when it comes to supply of oxygen. He was talking about the examples of Madhya Pradesh or Gujarat, where there are less active cases compared to Rajasthan, but they are getting more oxygen quota from the central government. So that is one. Then the next is it comes to this remdesivir drug. And the third is about the vaccines. When it comes to vaccines, they are saying Rajasthan, for instance, the health minister was saying the state has a capacity, the capability to vaccinate 7 lakh people every day. Similarly, Chhattisgarh was saying around 3.5 lakh. That is a capacity they have managed to scale up over the last 2-3 months. But again, this shortage is what they are now really staring at. Yesterday, Mr. Amrinder Singh, the Chief Minister of Punjab, he also directed the state health department to place an order of 30 lakh Covishield doses for vaccination of the 18 to 45 age group, and officially put out a statement saying, although the Chief Minister has asked the department to place the orders, information provided by the central government for delivery of vaccines is that it's not expected before May 15.
So, has the center responded to all of this?
So far, they have not, but soon they will come out with detailed plan of action. That's what we are given to understand on this third stage of the vaccination. So all the states have been asked to submit a 15-day action plan to carry out the drive, and the center in the next, I think, 2 days, they're expected to come out with a plan of action.
And what is the concern being raised regarding the pricing of the vaccine?
The differential pricing, that's what many of the states are concerned about. And the fact that they will have to put the bill and the financial burden will be on them. So most of the states, opposition rule states, are telling the center that vaccination of this scale has always been free of cost. Now, many of the state governments, for instance, Rajasthan, Chhattisgarh, they've all declared that the vaccines will be distributed free of cost in the government hospitals, of course. So the financial burden will be on the states. So they argue that right from the BCG or from polio vaccines, it has always been free of cost, and it is always the center used to procure and give it to the states. So the Chhattisgarh finance minister has argued that there was a 30,000 crore allocation in the last union budget for this exact purpose, for managing the vaccination drive and activities related to COVID. So why is the center abdicating that responsibility and putting the burden on the states? That's a political tug of war between opposition and the government that has not been sorted as yet.
And finally, Manoj, what has the Central Congress leadership said regarding this entire affair?
They have been continuously articulating their position. Even yesterday, Mr. Randeep Surjewala, the Congress's communication department chief, he came out with a detailed statement alleging that the government is letting these two companies profiteer at a time of crisis. In fact, he has said that he has quoted a figure of 1,11,100 crore. It's like 1,11,000 crore. He's saying both these companies will profit out of this vaccination drive. So they have been constantly saying that the center should step in, tell both these companies not to do this differential price mechanism, and the center should procure and give it to the states.
And now for the latest COVID-related updates. The central government on Monday asked the Serum Institute of India and Bharat Biotech to lower the prices of their COVID-19 vaccines amid criticism from various states who objected to profiteering during such a major crisis. The issue of vaccine pricing was discussed at a meeting chaired by Cabinet Secretary Rajiv Gauba. The Hyderabad-based Bharat Biotech has fixed the price of its vaccine, Covaxin, at 600 rupees per dose for state governments and 1200 rupees per dose for private hospitals. Meanwhile, the Pune-based Serum Institute of India, the world's largest vaccine maker in terms of volume, has announced a price of 400 rupees per dose for its vaccine Covishield for state governments and 600 per dose for private hospitals. Both the vaccines have been made available to the central government at a rate of 150 rupees per dose. Many states have also objected to different prices of the vaccines, with Delhi Chief Minister Arvind Kejriwal saying that this is not a time for profiteering. The Madras High Court yesterday said that the Election Commission of India is singularly responsible for spreading COVID-19 and that murder charges should probably be imposed on it for its irresponsible behavior. Criticizing the Election Commission for not stopping political parties from violating COVID protocols, the bench said that the Election Commission was the only institution responsible for the situation that we are in today. Asking whether the poll watchdog was on another planet when poll rallies were held, the court said, and I quote, "You have been singularly lacking any kind of exercise of authority. You have not taken any measures against political parties holding rallies despite every order of this court saying maintain COVID protocol, unquote. Reminding the Council of Election Commission that it is all about survival and protection now and that everything else comes next, the court further said that it would issue orders to stop counting if the Election Commission fails to prepare a blueprint before the 2nd of May on how COVID protocols will be maintained during the process. In Karnataka, the Chief Minister B.S. Yediyurappa on Monday announced a 14-day lockdown that will come into force in the state from 9 p.m. today to curb the spread of COVID-19. No public transport will be allowed to ply on the roads, but shops selling essential commodities will remain open from 6 a.m. to 10 a.m. every day. Yediyurappa indicated that interstate and intrastate travel other than movement of goods and cargo will not be permitted during the shutdown. However, people wanting to get vaccinated will be allowed to go to their vaccination centers. The Chief Minister said that the government will also seek the postponement of all polls in the state for the next 6 months. You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Snigdha Sharma, and was edited and mixed by Suresh Pawar. You can follow us and leave us feedback on Facebook or Twitter at Express Podcasts or send us an email at podcasts@indianexpress.com. And if you like this show, please do subscribe and leave us a review wherever you get your podcasts from so more people can find us. You can also look for us in the audio section in the top right corner of our website, indianexpress.com.